Good afternoon, everybody. I'm Shay Ali here with you on Inspired Online. And today we go all the way out to Amsterdam for the gorgeous Dr. Louise Lagendijk. I hope I said that correctly. Now, Louise is a medical doctor, but she works in preventative health. So she helps women specifically find their core and, works with people as a holistic person. So it's not just going to a doctor and saying, I've got this, okay, this is a one size fits all. It's working with people on an emotional, spiritual, mental, medical level. So she's got so much knowledge and does so much beautiful work with the ladies out there. So I'm delighted to welcome her to Inspired Online today. Welcome, Dr. Louise.
Thank you very much, Shay. Thank you very much. That's a lovely introduction. Thank you.
Thank you I'm going to start, well, you deserve it. And I'm going to start with a question that I ask all our speakers, which is, if you had to share your wisdom with the world in a nutshell, what would you say?
Well, right now, I would definitely want to share something that makes me very happy. And even though I know we're in unprecedented times, and I know that everything is different for many people, right? There's nothing that has been the normal. Me asking what was normal in the first place, did we even know what that was? And we're shifting, right? We're shifting dimensions, we're becoming more aware. It's a shift in awareness just as much. And there's just different camps. You see different ideas about everything. And I think that's beautiful because people start to think for themselves, which is one of the things that I'm doing at the core also, is trying to get you back to what's true for you. Same in my medical practice. I don't know your body better than you do. I know that you've been in that body for God knows how long. And you are basically an accumulation of everything that has happened to you, that you've absorbed, that you eat, that you think, that you basically are as a whole, hence holistic. And what I learned today was that even though I go high and I stay in my own zone, and I could talk for hours about staying healthy and all these things, yada yada, I think we all got that note. The thing is more that what I learned, that you can work on different levels. So you don't only have to be keeping your own energy up and being all happy and vibrant and all the time, because it's not really what's true. It's not really what's true. That's the whole joke. You can do things at multiple levels, and that I mean also, for instance, I signed petitions. And what I learned today is that many doctors, 1,600 healthcare professionals here in Holland, have signed petitions and have signed off these papers saying, listen, why are we actually spending money on vaccines when we should be taking care of health? My absolute amen moment today, because this made me so happy, because I've always said I've been more interested in keeping people healthy than curing their disease. And I was at a certain point, because I'll talk about what I went through and what I think we've all been through, because we went through collective grief.
Absolutely.
All the stages, right? I went through anger in the beginning. At first it was denial. I'm like, you gotta be kidding me. I said, no, this will be 2 weeks. 2 weeks, it'll be done. I remember saying to a friend of mine, I was like, no, it'll be done in 2 weeks. And then he said, oh, Louise, it's going to take months. Like, don't be silly. It's not going to happen. And then afterwards, I figured out that it was going to take so much longer. And rage came. Honest to death, I hit a pillow here. I really was so angry, because I thought, why is the world not seeing what's happening? Then there was obviously frustration. And then, then resignation comes. So it's like, okay, leave it. And then ultimately acceptance comes, because that's the circle of grief.
Yeah.
And the beauty of this is that when you see that people are actually, for one, trying to see that this is not something that has happened to them, right? Everything happens for you. We've all been there.
Yes.
That they're actually, I remember at a certain point I said, why doesn't my prime minister, our prime minister here in Amsterdam, put these bags on the houses of people with, healthy foods, with whatever supplements people need? Why are we not, spending money on that? Why are we spending money on keeping, on a vaccine? I could not figure this out in my brain. I could not. I still today cannot. But now it makes me very happy because I see that there's movement. I see there's movement towards lifestyle. I see there's movement towards people making choices for themselves. And that's what I find the most important thing, to be able to choose for yourself and to really follow. Because if the whole world has 10 different messages, then the only question is, what's true for me? Right? What do you resonate with? What makes sense for you? And if you have 60 million different ideas around you, then we only have one thing, and that's gut feeling. Like,
Yes.
no, I think we all have a deep knowing. I think it's just what we're born with. And to really just trust that instinct. You go like, does this make sense? I remember being at Harvard working with pharma, and all of a sudden they asked me to test another drug. And I mean, pharma's not all bad, because that's why I could, develop organs on chips, and it was amazing. But
yes,
I remember working there thinking, it doesn't really make sense. You got this, huh? Huh? Doesn't really make, and science doesn't always make sense. Me being that heart, being in science for years, it doesn't always make sense. But what does make sense is what you know to be true. So that is beautiful. And I think when we talk about the grief process, I think it is all about feeling the feels, right? I mean, nobody knows how to do this right. Seriously, there is no right way to do this, and you can shift your state as often as you want to, but some emotions just want to be felt. And that's I think the most important thing. If you are angry, be angry. If you're frustrated, be frustrated. And then let it go, honestly, just to feel the feels and love yourself through it. That's all we need to do. Just feel it, and to really have, and that I think is the most important thing right now, to have compassion.
wow,
Just compassion, for yourself most of all. You're going through a grief process. You're going through a process that nobody's ever done before. There are no ways. And it's like we're doing, I feel like it's emotional exam. Like you've got your toolbox, you know what to do. Like, how are you going to show up when crisis comes? What are you going to do? Who are you going to be? How do you want to live? And also, are you allowing yourself to feel the feels? Because ultimately, an emotion is nothing else than a feeling that wants to be felt. And can you be the observer? Just that.
So, you say about the importance in feeling our emotions, and if you're angry, let yourself be angry. Two things about that really that I wanted to ask you. One is, can you tell us what the benefit is of feeling that emotion rather than suppressing that emotion? And secondly, is there a time limit? Do I have to be angry for a month if I'm angry all the time, or should we be limiting, that feeling?
Yeah. Well, first of all, science has shown that you can only feel a particular sensation for 90 seconds. And if you just feel it and really feel it without, and here's the story, here's the joke, without reinforcing the story that made you angry in the first place, or that made you sad in the first place. It is nothing else like a wave that comes to you. And we all are aware right now, doing mindfulness and everything, that we've got thoughts and they come, like clouds, and they come and go. It's the same with emotions. It's the exact same thing, right? They come and they go, but just please let them come, right? And if we do, and again, if we have that, if you allow yourself at least that minute and a half to just feel it, because there's so much stigma almost around, you got to be happy all the time. And that's not healthy, because babies cry, right? We're not very different from them, actually. We just evolved in a way that we think we are, but maybe we've revolved, but that's a lot of discussion. To just allow yourself to feel things and to love yourself through it. Because I think the most important thing is that when you're a mother to a child, you nurture the child. You go, oh, are you okay? Are you, you just nurture yourself? Sorry for my swearing. Everybody's hurting right now. There's so many people who don't know what's next, who are in anxiety or stress, and others are doing perfect. It doesn't matter where you are. Can you be happy? Love yourself through that. Can you be sad? Love yourself through that. Like a mother to a child. And just really be that, compassionate. Because if you can be it for yourself, have this corona compassion that I think is like what I said, our emotional exam.
I
right
like
now.
that term, corona compassion.
Yeah, it was the first term I came up with when this whole thing happened. It's like, I'm going to make this a hashtag. Never did it. I can't be bothered. Can't be bothered. But
It's very important.
Because it's so important right now. If you cannot cultivate it at home for yourself, for your partner, you're not going to be able to cultivate it for the scared lady in the grocery store. Because, right, we don't know what she's going through. We don't know if she has a husband who's terminally ill. We don't know. We don't know anything about other people. All we know is what we see. And when we, are compassionate towards them, then beauty happens. Then we soften. And we can feel it for ourselves. I was having dinner the other day with some of my friends, and we were just sitting there, and there was no distance. I can tell you, I'm sorry for people, but there was no social distancing. And we were just sitting there. And this owner of the house came in, because it's a rent house. And he's like, are you having a fuck corona party? And these were just, very high educated people that I was with.
Right.
And we were just having conversations about what's going on in the world. And the first thing I said was, bless his heart. Bless his heart. He's scared.
Wow.
He's just scared, and that's okay. Can we love him through it? Because he's
gorgeous.
No, right? And that's, I think, the thing we should all be doing right now, or at least try. And really go, all right, loving you through it, loving you through it, loving you through it. I'm loving you through it. And it's okay, it will go away. I think this is something we can say to ourselves when we experience emotions. It's okay, it will go away. It's okay, it will go away. And it's the same thing to other people who are, screaming to you like, distance, because this happens in Amsterdam as well.
Okay.
and to just say, it's, and in your mind, say, it's okay, it will go away. It's not going to be forever, right? We all know that. But to have that compassion, I think is ultimately is key.
Wow. And I love that example you shared, because it's compassion for someone that, was trying to be angry with you, I guess. And my next question, maybe a bit controversial, this question, because let's say, do we need compassion for someone like Donald Trump, as an example? Because he's a figure that a lot of people are talking about, that a lot of people are insulting right now. And, okay, I don't want to say anything defamatory about Donald Trump, or anybody on this forum. But what if it is someone like that who really triggers, your emotions, and you think, actually, this person is doing bad and dangerous things? How should we show compassion for them, and how would we do that?
Yeah, so I think it's a great question. First off, to start with, have compassion for anyone you meet, especially the ones you find difficult, especially those. Now, this doesn't mean that you agree with them. That's completely different, right? I do not agree with our Prime Minister. I do not agree with him at all on the decisions that he's making in healthcare right now, and everything that he chooses to do is the same story. And, he says things that are freaking bullshit, to be honest with you. I hear our Minister of Health saying things, I'm like, it's not even true. It's not even true. And then I can do two things. I can go, you're an idiot. No, you're not well informed, and you could be an idiot. And I can have compassion for you. That is all possible, and that's why I'm saying we can function at all these levels. I can have compassion for everybody who's going through this. I can have compassion for, this whole going high five. And at the same time, I'll sign a petition. At the same time, I'll make sure that my voice is being heard. Because being compassionate doesn't mean that you're going spiritual bypassing, sitting in a corner going, I love everybody. That's bullshit. You can do both. You can say, I do not agree, and I have compassion with you. Sorry, but these people who hurt people, the saying, hurt people, right?
Right.
They need compassion than anyone, but it doesn't mean they have to agree with them. But if you're gonna hate him, who has to feel hate first? Me.
Very interesting.
He's not gonna feel my hate. I'm gonna sit here with my hate. Sitting here with my hate. And I can't do anything with it. I'm not saying be complacent. I'm not saying don't voice yourself. I'm not saying don't speak up about this. Absolutely, say what it is you want to have said. I speak up. I talk about these things around healthcare all the time. And I have compassion with people who are in these positions, even though you can be a freaking moron. Yeah. That's
Okay.
all. Sorry, that's all possible. Yeah.
No, I think that's also really wise, actually. You know, compassion is not the same as agreement. So, you know, they're the two. And that's what I really get from what you're saying. And I think what a lot of people could benefit from recognizing, actually. Going back to something that you said at the beginning, it was that concept of preventative care and keeping us healthy, right? Are there any things we can do to keep us healthy? I mean, as a doctor, obviously you've got a very different insight, or you've got a broader insight into what that might be, potentially. But what are some simple things that we can do?
So this is going to be super, super basic.
Please, that's fine.
And that I think is most important. First of all, it's just basic stress management, because we all know that panic and stress creates inflammation in the body, and that compromises the immune system. So you can eat as much broccoli as you like, but if you're going to be a hothead and you're going to be angry with the world 24/7, you're still going to have a completely ramped up inflammation in your body going on. So for me, it starts with just keeping your calm. That's the first, really. Do what it is you can do, right? We all know circle of influence, out of your influence, what's in your sphere. Focus on what you can control. Very simple. And to really be aware of your stress levels. First and foremost, sleep. Get your sleep. Get your sleep. Really.
And how much sleep should we have? Because there's different theories on that as well. But how much do you feel we should have?
A very good question. It's really interesting, because I am interested always in sort of more personalized prevention. And then I'm going to take it one step further, because we can now all go to the point where we say, all right, so preventative health is important. Yeah, exactly. But we all have different body types. I'm a woman, you're a woman. We need different things than men do. That's a first. Then the same thing is that my body composition may be different than yours. Then, you know, your age, maybe, you know, our hormone levels are different. All these things contribute to what you ultimately need. So saying that it's not one size fits all. It never has been. It's not one pill for every ill, but it's not one preventative protocol for everyone either. Right. So we need to know our body. And I think that there are, you know, different people know what kind of sleep they need when they are, for instance, on holiday. When you're not on a schedule, then you sleep the amount of hours that you actually need. We're like animals, right? If you would just not have a phone, just go with the cycle, right? Go with the sun. And some people need less sleep, other people need more sleep. There is no, I mean, they always say around 8 hours will do you good. I agree. That makes a lot of sense. And we're different. We're all different. Really, we're all different. And then get your water in, get your fruits in, get your veg in. That's nothing else. Make sure you get, you know, your right supplements in. I think everybody knows vitamin C, vitamin D, selenium, zinc. These are things you can take for yourself. We've all seen the amazing posts online, and everybody now knows what to do, which makes me super happy, because I'm like, okay, that's great. Thank God. People are like, oh, I got something I could do myself. And that's great, really. That's really good. And and most of all, I think it's really important to stimulate the relaxation response, because when I say no stress, I also really mean stimulate the relaxation response. One of the important things we can do right now, especially when we're home, when you're not around other people, still, you know, get your physical touch in. It's important.
How do you do that if you're on your own?
That's a very good question. It doesn't necessarily matter if you have somebody else hug you or you hug yourself, because you will you'll still release oxytocin. And oxytocin stimulates the parasympathetic nervous system, which is the opposite of the sympathetic nervous system, which is our fight flight. So when we do this, we actually create oxytocin in the body. And that is the parasympathetic relaxation response. It is when we feel connected, right? It is the hormone that mothers make when they give birth to a baby, and it makes them connect to a child. And it's also the way that we connect to ourselves. And I think that now more than ever, as we were talking about, you know, being like a mother to a child to yourself right now, everybody really, you know, just love yourself through it. Nobody knows how to do this stuff. Hug yourself, massage yourself, same thing. It's the same. And beautifully enough, like in ancient Indian culture, they had Abhyanga, which is this, you know, self-massage.
Oh, wow.
How
does that work?
And that's really beautiful because you can do that yourself in just long strokes. And it basically means, you know, they did like this oil, but using this oil, but oil in Sanskrit means love. And
oh, wow. Okay.
When we really put that love and that oil on ourselves, it's like you really have a moment of deep respect and self-love. And maybe we can like oil the world a bit, you know, to not be as stagnant, to oil it out a bit, to not be left or right, to just soften, to smooth, you know, oil smooths things. Yeah, that's, I think, very,
Wow. If there was one change that we could all make to take forward into our new reality, the new normal, as our government calls it, what would you like to see people do more of?
I'd actually like them to really, let's say, remember the moments that they felt best during these last months, because I know that there have been many people who felt good as well, right? Not having a busy schedule, etc. And to really know what were the conditions, like what were you doing that made you feel so good? Because then you can repeat it. And I think that that awareness of what made us feel good is something we can take with us. And it could have been that one meditation that you found out. It could have been that one, you know, that feeling of not having a full schedule. It could have been that one but it's all feelings, right? Everything we do in life is we think we're going to feel this emotion. And to really take care of that, then we take along the being healthy, then we take along the, really taking care of the body, that all these things, there's been so much beauty in this as well, really, and especially on like personal level, and personal level eventually is global level. So that to just, because I mean, eventually what we all did, we went home, right? We all went home. And many of us have found more home in themselves.
Wow.
And to keep that place home with you, wherever you go, because it's always there. Okay? Yeah. Always there.
Well, if you're one of these people that hasn't found home within yourselves yet, and we're still sort of in lockdown, how can you do that? What would you encourage those to do that are not feeling that at the moment?
To be not feeling that, and to be okay not feeling that.
See.
Yeah, really, it's okay. Like I said, we are going through a grief process. I've been through all of them, right? I go through some of them in a day. I'm not sitting here being, super zen 24/7. I'm not, because, this is how it feels sometimes. And thank God, why is life be so freaking boring? And so if you feel depressed, if you feel down, if you feel that things are not going the way you want them to, be compassionate with yourself. Sweetie, seriously, you're trying to live during crisis. Living by itself was hard enough as it was, right? There was enough stuff that people had to deal with, right? You gotta be healthy, you gotta do this, and it's okay if you have not written the book, if you've not, got the fit body, if you've not been able to manage everything, if your relationship has just gone to shit. Yeah, that just happens, it's life. And it will change, because you're not gonna be here forever. Know that you're not going to be here forever, And the only thing that is constant in life is change. So please, if I could tell anyone who feels like shit right now, the only thing I was going to say, I love you. This will go away. And by being okay with the fact that it will be, that it's there, I tell you, it will change.
Yeah.
Because if we fight, we're not going to win. Right?
No, I agree. It's been so amazing to spend time with you today. It's been truly beautiful. Do you have any final thoughts you'd like to share with our audience?
Well, what would be a final? Yes, again, really, I think eventually it all really comes down to being able to say, all right, have we ever thought of that existence? It's not something to take for granted.
Yeah. And
can we be grateful for just merely existing, whatever the form of it may be, however we feel right now, right? Maybe we've taken existence for granted. Can we be grateful for merely existing? That's, that I'd love to. Yeah.
Beautiful. Thank you. If our beautiful audience would like to get in touch with you, how can they do that?
They can find me through my website, which is, I think it'd be best to give you this website. Or maybe Instagram is easier, because I'm on Instagram these days doing
Go for it. We can share all the links with the video anyway, but just give us your Instagram handle.
Yeah, that's a good. It's at The Core Women Care.
The Core Women Care. Beautiful.
Yeah, that's it.
Right. Thank you so much. Take care of yourself.
Thank you. Thank you very much for this. It's absolutely beautiful to be able to do it. And you're doing amazing work. Really.
Thank you. And you keep on going.
Yeah, I need
Lots of love.
Lots of love. All right. Bye, dear.